I tell patients in terms of post-op recovery from hysterectomy, it's highly variable. If someone has a relatively sedentary lifestyle and a relatively sedentary job where they're sitting at a desk and they're not doing any heavy lifting, typically those patients can be back to work very quickly. I've had some patients incredibly go back to work in a day or two, and I've had some patients take up to 2 weeks for a relatively sedentary job. I would say that's a spectrum of different people with different attitudes. On average, patients will have a surgery on a Monday or Tuesday and be able to go back by that following Monday. In terms of a physical job where you're doing lifting more than 30 pounds or you're using a lot of abdominal forces when you're doing whatever activity you're doing, like aggressive exercise, that's probably more like a 6-week recovery phase. As far as calling the office or coming in for post-op issues, I have an open door. I'd rather see the patient than not see the patient, so anything that they have a concern about, I would want to hear about. As far as the emergency room, I think that's when, if there's some scenario that we're not available, a Sunday at 2 o'clock in the morning, and in their perception, in their mind, something serious is going on, I'd rather you go in than not go in. It's difficult for a patient to recognize some of the subtleties of what's an important thing and what's something's no big deal. If you in your mind think it could wait, every day we have open spots and an open door policy for those patients to come in.